And Jeff, feel free to stay on if you have a few minutes to listen to.
I'll have to
Gabriel
go.
Zucman.
So
are you here,
let me say thank you to all of you.
I
and
have not met
congratulations.
Gabriel yet, so this is, I've communicated with him. Gabriel is an associate professor at Berkeley. Please come on up, Gabriel, who has done incredible work documenting how we can quantify where the rich hide their money. It is a transformative opus of work that opens the way to, dare I say, tax that wealth? Is it that, perhaps? He is thus part of an extraordinary team at UC Berkeley looking at inequity issues and how to remedy them. We are thrilled that he is coming here today, not far from his home base, to talk with us. Nice to meet you.
Perfect. Thank you. Thank you so much. So financing Medicare for all. So the starting point is there is a consensus that everybody should have access to healthcare. What does that mean? You know, let's try to think about the funding equation here. U.S. healthcare costs, as we know, are record high. The U.S. spends 20% of its national income in healthcare. That's $15,000 per year on average per adult. That's really important to understand. On average, the U.S. spends today $15,000 a year per adult. The U.S., as we know, spends much more than other wealthy nations, but even in Europe, even in Japan, even in Canada, healthcare on the cheap just doesn't exist. There's no cheap way to treat cancer. There's no cheap way to treat heart diseases. So all countries, even those that try hard to control costs, spend at least 10% of their national income on health. 10%, that would still be $7,500 per adult on average in the US. That would still be a lot. And that means that a full private funding of healthcare is not possible. Just to fix ideas, today, the average income for half of the US population, for the bottom 50% of the income distribution, is $18,500 per adult a year. So half of the US population lives with an average pre-tax income of $18,500. It's not possible to pay $15,000 for healthcare. It's not possible to even pay $7,500 for healthcare. That's why there's a need for public funding. And there's a lot of public funding already with Medicaid, with Medicare, with Affordable Care Act subsidies. But none of that alleviates the cost of healthcare for working families, for workers who have to fund their healthcare through private insurance premiums. And that's what I want to talk about today. I want to talk about the funding situation for the more than 100 million Americans who have to fund healthcare by getting private health insurance, mostly through their employers, and how unfair that system is, and how it could be replaced by something more sustainable. The way this works today is that health insurance for workers is funded through what you could call a huge privatized poll tax. So let me explain. Both employers and employee-paid insurance premiums reduce wages for workers. They are like a tax because they are mandatory. Any employer with more than 50 workers has to offer insurance to their workers. That insurance, these insurance premiums, whether they're nominally paid by employers or nominally paid by employees, they have the same effect. They reduce the wage, the take-home pay of covered workers. Second, these premiums are like a poll tax or a head tax because they're essentially a fixed amount per head. The secretary literally pays the same as the executive, roughly on average $13,000 per covered worker. Third, it's a privatized tax because it's not, paid to the government. It's managed by employers on behalf of the government. Government says, look, it's compulsory to be insured, but employers are going to collect the premiums, are going to remit those premiums to private health insurance companies. It's like a tax, but it's a private tax. And it's crashing because this tax is growing very fast. Private health insurance premiums now amount to 7% of national income. That's about 10% of labor compensation in the US. So let me illustrate the magnitude of that private tax. This is a graph that shows how much taxes the various groups of the population pay today as a fraction of their income. So on the x-axis, you have the various income groups. P0, P10 is the bottom 10% of the income distribution. So the 10% of Americans with the lowest incomes, and P10, 20 is the next 10%, and then it zooms on the right, up all the way to the top 400 richest Americans. And so then you see the various taxes. So consumption taxes, sales taxes essentially are very big as a fraction of income for poor Americans, for low-income Americans. Payroll taxes are very big and small at the top because they're capped. The individual income tax, is not a big tax for the working class, the middle class, but it's more sizable at the top. And then you see the blue area is adding to these regular, public taxes, consumption taxes, payroll taxes, individual income taxes, adding now these private, poll or head insurance tax. And it is huge, for the middle class, what the middle class pays in private health insurance premiums directly or through their employers, that's more than 10% of their income. That's more than what they pay in individual income taxes. That's more than what they pay in payroll taxes. That's the biggest tax of them all. And it's hugely regressive because since it's a fixed amount per head, for the wealthy on the right-hand side, it's essentially nothing, 0% of their income. So that's the current situation. How do we fix this mess? The solution involves replacing these private insurance premiums by taxes based on ability to pay. That is based on your income, maybe your wealth, and there are tons of ways to do that. But the most important thing to understand is that no matter how you do this exactly, no matter how you replace private health insurance premiums by taxes, since the current premiums are so regressive or so unfair, if you replace those by taxes that are proportional to income, or maybe more than proportional to income, progressive, higher rates when your income rises, this would lead to a huge reduction in costs for the vast majority of working families. So let me give one simple way to transition to Medicare for all funding is scrap all private insurance premiums and replace those by, let's say, a broad-based tax proportional to income on all income sources, on all labor compensation and profits collected by employers. So you could have a tax at a rate of 6% on all labor costs, all profits, and that would be enough to replace all private insurance premiums. That's a huge, if you want, flat tax. That would be much more fair, much more progressive than the current insurance premiums. You can do more than that. You can have, instead of a 6% rate, you can have 4% and add progressive income taxes, or maybe a progressive wealth tax, or maybe a higher corporate income tax rate. No matter how you do that exactly, if you do this, this would lead to the biggest take-home pay increase in a generation for working families. So that's really the most important point, and that's what I want you to understand. Let me give you an illustration, and let me make concretely very clear how this would work. Imagine Medicare for all passes. becomes law. How do we transition to a fairer funding model? How do we fund Medicare for all? In year one, you could have a law that would mandate the conversion of private insurance premiums, both paid by workers and employers, into wages. In year one, there's a law that says if your employer last year contributed $10,000 to an insurance company on your behalf, now instead of paying $10,000 to the insurance company, they have to increase your wage by $10,000. Okay? For employers, look, notice that for employers, this is neutral. It changes nothing. Instead of paying $10,000 to private health insurance companies, they increase your wage by $10,000. Nothing changes. Year two, or you could do in year one at the same time, but maybe it's simpler if you do it in year two. The government introduces new taxes. Can be a broad-based income tax that I described. It can be a progressive income tax. It can be a wealth tax. Let me illustrate how things would change if the government introduces a flat 6% tax. Let me take the case of a worker who today has a wage of $40,000 and pays directly and through her employer $12,000 in health insurance premiums. For that worker, her true labor compensation today is $52,000, but $12,000 are eaten by healthcare, go directly to health insurance companies. In year one, the wage of that worker would rise from $40,000 to $52,000. In year two, there's this 6% tax that's introduced, 6% of $52,000, that's $4,200. So the net wage, net of that tax, would fall to $47,800. Notice that this is still $7,800 more than the current wage of that person. So all included, this is a 20% net pay increase. This would be the biggest pay raise in 40 years for tens of millions, for close to 100 million working families in the US. And, that's enough to fund Medicare for all. That's all it takes. You can, if you have more aggressive cost cutting, you can have a lower tax than 6%. Okay, but essentially that's all you need. And of course, if you do a fixed, a flat tax, 6% on all income, 90% of Americans win from that, because today they have to pay these fixed premiums, who are huge as a fraction of income for the bottom 90% of the population. And they would have to pay these taxes based on income that would be less than the current premiums. But for the top 5% richer Americans, their taxes would have to increase a little bit. That is what this graph illustrates. But the basic point, and what I wanted to emphasize, is if you do this very simple fix, you replace insurance premiums that are fixed amounts per head today by taxes based on ability to pay. No matter how exactly you do this, you ensure that you can make sure that more than 90%, maybe up to 95% of Americans benefit from such a change in funding. And for tens of millions of Americans, that's the biggest take-home pay increase in a generation. Thank you very much.
So 2 questions. One, where would the money come in the first year for the system? And 2, why not do it both at the same time? Because people don't like you give them something and then you take it away, even if they end up with $7,800 more.
Yeah, these are very important questions. So if you do, the transition in year one and new taxes in year two, obviously you have a deficit, government deficit in year one, which is a very temporary government deficit. You would have a deficit, you increase the deficit by maybe 4 points of GDP in 1 year, okay? And, it's not a big deal because it's temporary. Everybody knows that this is just in year one. The advantage of doing things this way, where you convert premiums in year one, and then you introduce taxes in year two, is that it makes things really clear. Everybody understands in year one, look, I used to be paid $40,000, but in fact, my true wage was $52,000. $12,000 used to go to health insurance companies. That was eating my paycheck. And now, finally, I get back what I used to pay to these private health insurance companies. It makes things really clean, very clear. It's easy to monitor that employers increase the wages of their workers one for one. It's important to have a law and to think about the enforcing mechanism. You want to make sure that employers don't pocket the difference, and that they don't pocket the health insurance premiums. And doing things that way makes it very simple to monitor that there is indeed this full conversion of all premiums, employee and employers, into wages. But look, I have no problem with doing both things at the same time, the mandatory conversion and introducing the new taxes. It's in the end, it's a political decision. Economically, it makes no difference, essentially. Yeah.
Is it really neutral for employers if they raise wages? Doesn't the payroll tax increase?
So what's neutral for employers? Employers today pay a lot in health insurance premiums to private health insurance companies. So if today your employer contributes $10,000 on your behalf to a private insurance company, it's neutral if instead of paying $10K to a private health insurance company, they increase your wage by $10,000. For them, it changes nothing. The labor cost is the same. Or to put it differently, today the true labor cost for an employer of someone whose wage is $40,000, but whose healthcare costs $10,000, the true labor cost for employers is $50,000. They pay $50,000 to employ that person. $10,000 goes to health insurance companies. Only $40,000 goes on that person's bank account. Removing the 10K payments, increasing wages by the same amount is fully neutral for employers. And I think employers, they would like a system like that. Because right now they have to spend, they have to administer this private poll tax. They collect they remit the premiums to insurance companies. It's costly for them. In the system that I described, employers wouldn't have any more to care about healthcare. That would be done by the government. It's not only that this would be neutral for employers, it would actually be a net gain for employers.
How would this work for the small business owner or a private practice physician who may have 5 employees? And how would it work for someone new that you hired who didn't have a history of having health insurance with you the year before, et cetera?
Yeah, that's a great question. So it all depends. For private businesses, if they were covering their workers already, same thing. Mandatory conversion of premiums into wages. If they were not covering their workers, in that case, what happens is the workers in year 2, in effect, would have to pay a bit more in taxes, depending on what taxes fund Medicare for all. But on the plus side, they gain health insurance. So today, these workers were not covered, and in a system like the one that I described, in year 2, maybe their taxes go up a little bit, but now they have coverage. You can imagine to collect taxes in such a way that nobody would have to pay more in taxes, that there would be exemptions for low-income workers, or that people who used to pay who used to be not covered in the previous system wouldn't have to pay new taxes, so that absolutely everybody, at least in the bottom 90% or the bottom 95% of the income distribution, gains in monetary terms from the transition to Medicare for all. But you don't even have, to do that. You could do that if you want to do that. That's totally doable. Yeah.
A lot of the initiative for Medicare for all was coming from the states. And have you worked out how this could be done on, rather than a national program, on a state basis like California or Oregon?
Yeah, so that's really important. Yes, this can be done at the state level. A state like California could absolutely do that, could say, look, if you are employed in California, we're going to collect new taxes on employers, like this 6% national income tax, or we're going to increase the individual income tax, or we're going to introduce a wealth tax, or we're going to do that at the same time to fund Medicare for all for California. So this can be done at the state level. My guess is if the federal government fails to act past 2021, I think it's plausible. It's possible that we'll see initiatives like that at the state level and possibly in a state like California. It's the next administration. That's
we have to stop.
Yes.
So I'm sorry, but we're going to have to continue on to the next panel because we're already behind. So a big round of applause for Gabriel.